Hello, hello, hello. This is Katie Dinges, Executive Director of Jana's Campaign, and I am joining you all live today to discuss our Purple Chair Chat for the month. May is Mental Health Awareness Month, as some of you may know, and so we're going to discuss the connections between mental health and domestic violence. Our Purple Chair Chats are important live conversations discussing and instilling knowledge, skills, and the values necessary to prevent gender and relationship violence. And so today, like I said, we're going to chat about mental health and domestic violence or gender-based violence, intimate partner violence. And so first I want to start out with a definition of what exactly is mental health. And it's a person's condition in regard to their psychological and emotional well-being. And our mental health affects how we think, feel, and act. And it can help us, it determines how we handle stressful situations, how we relate to others, as well as make choices. And, mental health is really important at all stages of our lives, from childhood to adulthood. And of course, over the time of our lives, we will, experience different things, and that can affect our mental health, and it can affect our thinking, our mood, and our behaviors. And some factors that can contribute to mental health issues could be, family history of mental health, so it's biological, as well as trauma that we've experienced or abuse that we've experienced, and that's what we're really going to dive into today. Those who are experiencing abuse or violence in their relationships or just in their life are at greater risk for mental health issues. And so it's really important to have these conversations to be able to work on our mental health and have access to resources to improve our mental health and make sure that our mental health is healthy. And it's important to know, and this is one piece of information that every time I hear it, every time I read it, I'm just like, wow, this is a reason why everyone should care about domestic violence and preventing domestic violence or intimate partner violence. And the CDC reports that there is an overall healthcare system cost of $5.8 billion a year just due to intimate partner violence. But when we break it down into the overall cost for mental health care, it's $1.4 million. And so we can see that overall the issues of gender and relationship violence are costing our healthcare system a lot, but specifically mental health is also a big expense when we're talking about the healthcare system. Exposure to domestic violence has a significant impact on children's mental health, and there are studies that show a strong linkage between poor educational outcomes as well as higher risk or higher level of risk for mental health issues as children grow up as well. And we're going to talk a little bit more about that. I have some other statistics that I want to cover as well. Approximately 20% of intimate partner violence survivors reported experiencing a new onset of psychiatric disorders such as major depressive disorder or MDD, generalized anxiety disorder or GAD, and post-traumatic stress disorder or PTSD. And we commonly hear PTSD as a common diagnosis of those who have experienced violence or in their relationships or sexual violence specifically. And then also a wide range of substance abuse disorders. And traumatic brain injury or TBI, as well as non-fatal strangulation, are often unrecognized forms of intimate partner violence, and they actually have both significantly short and long-term outcomes for brain injury or brain neurological issues. And so those two are really important to understand and know that while they may not show physically, there might not be any physical marks left from strangulation, that it can have those neurological issues, cause those neurological issues. Chronic abuse may also result in compulsive and obsessive disorders, as well as self-destruction or considered suicide or completed suicide. And after enduring abuse, trauma reactions may lead to survivors experiencing difficulties in their relationships, whether that is an intimate relationship or a friendship, or just potentially even a workplace relationship as well. Intimate partner violence associated abuse may also affect emotional regulation, facial interpretation, and the reading of social cues as well. And victims often experience either self-hatred or fear, consistent fear. And I think it's also quite interesting to know that on average, a majority of women that are in receiving mental health services, they will share that they have either been abused or are currently being abused or experiencing violence. And so women that are, utilizing those resources, those mental health resources that are available to them, are disclosing that they have experienced violence in their lives. Many women were many women have been concerned that a diagnosis of a mental health issue could also lead to more violence in their relationship, or allow for an abuser to utilize that diagnosis against them and utilize that to either increase violence or manipulate them. And we know that also mental health issues don't, just occur while somebody is experiencing violence. It has long-term impacts, and the issues can far exceed the extent of the violence and the abuse past that relationship. Along with PTSD flashbacks of the issues that they've experienced, are a common occurrence. And here is some more information on the exposure of domestic violence on children and their mental health. Witnessing and experiencing abuse can lead to children being in violent relationships when they are older, as well as maybe even potentially being violent in their relationships, because that behavior is normalized to them. They may not know the difference between a healthy and unhealthy relationship. Teenagers who have been exposed to violence typically might engage in risky or possibly aggressive behaviors, as well as they are subject to more drug and alcohol abuse. And children may blame themselves for witnessing the abuse, and they may get in more trouble at home or in the school setting as well. Young children may revert back to toddler-like mannerisms like wetting the bed or thumb sucking, and they also might experience separation anxiety, have increased nightmares, and always be in a constant state of fear or terror. So it's really important that we have these conversations about what abuse can do, what violence can do, the trauma that can occur after somebody experiences violence, because it really can have lasting effects on our health, both physical and mental health, as well as our emotional health. And that can affect how we live our lives and how we, react to various things in our life as well. But it's important to know that there are resources available. Any domestic violence or sexual violence services can provide you with information about the effects on mental health, and they can make connections to mental health services. There are two services that I want to share that anyone can have access to. One is the National Domestic Violence Hotline. It is thehotline.org. They have information on their website about the connection between mental health and domestic violence, but also if you are ever in a situation and you need that direct assistance, that direct help, there is a hotline number that you can call, as well as information on their website that you can have access to that immediately. And then there is also a National Center on Domestic Violence, Trauma, and Mental Health, and they have tons of resources on their website about various, just material to learn more, but also connections can be made through them as well. If you are ever in need of assistance or any kind of resources, please feel free to reach out to us at Janus Campaign. We are more than happy to connect you with your local resources, whether that is a domestic violence or sexual violence agency or mental health services. We will do that research and work for you and make sure that you have access to that information. Thank you all for joining me for this quick Purple Chair chat. Like I stated, May is Mental Health Awareness Month, and while we wrap up the month, we felt it was important to discuss the connections between mental health and domestic violence or intimate partner violence. Please feel free to share, ask questions, email us, but we appreciate you joining us today, and I hope you have a great Friday afternoon.